My name is Alicia Staley. I am a 3-time cancer survivor. I am the co-founder of the hashtag BCSM Cancer Community. So if you are a social media person and happen to be tweeting today's meeting, you can stop by the BCSM hashtag and say hello. That is a community I started in 2011 to help breast cancer patients share information through social media channels. I'm very proud of the work that we're doing on that community. And I also, in my free time, I work at Medidata as their Senior Director of Patient Engagement for Mobile Health Solutions. And I probably should have a disclaimer page of some sort up there, but it's really hard for me to do that because I've been a patient, a cancer survivor for over 28 years, and my cancer experience has dovetailed with my professional career at so many different points that it's hard for me to take my professional hat off and put a personal hat on. So what you see is what you get with me, and Medidata has been very good about supporting and encouraging me to share my opinion at any point I get. So I'd like to start off with just a quick level set for all of us that I'm sure many of you have seen this quote before, but patients are the most underutilized resource in healthcare. And I'd love to be able to attribute that quote to one person, but it's been used so many different times in so many different places that I think it's just in the general lexicon at this point. But thinking of that from that perspective, I'd like to just share what my feeling is on sort of health literacy in clinical trials and what does it mean and what can we learn from the patient journey about improving how we interact with clinical trials. Where's Deborah Collier? Deb, here's your new image for health literacy. You can please use this slide, but I call this the Charlie Brown theory of clinical trial education comprehension, and it's basically the Linus and Sally, the Charlie Brown characters, sitting in the classroom. And if you've ever seen the Charlie Brown cartoons with the teacher speak is sort of this blah, 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 wah, wah, wah. And when you're first diagnosed with cancer or trying to make a decision about a clinical trial, that's exactly what you hear. You actually hear sort of blah, 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 informed consent, blah, 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 sign here. And that's the whole process. That's the context in what you're trying to make a decision. And it's very, very hard. And I think, Deb, you could probably rewrite this slide with blah, 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 positive test result or negative test result, informed consent, sign here. So you're at this point where you're sort of being hit with all this information, not given the proper context to evaluate it, take it in, process it in a way that really makes sense for you in that kind of critical moment. And I think if there's one thing that we can share from the patient journey, it's this. This is how we have to react to the information that's shared with us as we're making a decision. And this whole concept of health literacy for me is really evolving, because what's happening is as we learn more and more about how patients are learning about what is going on in a clinical trial process or how they're bringing information in, we're learning that people learn and process information in very different ways. Some people have to take it in through reading a book. Some people have to take information in through video, audio. We have to be able to present information in a way that a patient can receive that information. And if we can't present information in that way, we're really doing a disservice to the patient. It's about the context that the patient's receiving information. What's the situation? Have they just received a new diagnosis? Or are they coming back after one treatment or another has already failed? What's the technological inputs that this patient is dealing with? Are you trying to share information with them over the web? Are you presenting information in clinic on an iPad or a tablet? And really, how do you judge the comprehension level of the patient? We never take a moment to stop and say, do you understand this? And but in a way that makes sense for the patient. So I've had a lot of doctors over the years stop me and say, do you understand what we're talking about? And my first reaction is, yeah, I got it. And then I walk out of the clinic room because either I've been so overwhelmed by the information that they're sharing with me, I have no context or no way to truly comprehend the information that's been presented to me. And I think what I've learned over the years is I have to leave the appointment, take time to process, and then come back to my doctor and talk about it more. And I've been fortunate to be with the same oncology and primary care team now for over 25 years. And they've worked with me to learn how I like to take in information. So they know I need maybe an extra appointment or a phone call follow-up or an email follow-up to process what they've shared with me. And we have to be able to be flexible enough to allow for those kinds of interactions to take place in clinical trials. So we talk a lot about informed consent. Everybody's talking about informed consent, that this is sort of the way that we need to be looking at it. And I'm really thinking that we have to shift from informed consent to what I call educated consent. It's, yes, there is an informed consent process that we have to go through where a patient does need to sign off and sort of get the process moving for a clinical trial, but what can we do to infuse education around that process? If informed consent, the ultimate goal of informed consent is the patient's signature to move forward, what can we do? How can we infuse education in that process as part of this journey? And I think we don't do enough, we don't focus enough on education as a true multimodal learning opportunity. So are you an auditory learner? Are you a visual learner? Do you need to step away from the information for a moment and process it over time? And we have to sort of build these different multimodal opportunities into the whole consent process and really turn it into an education opportunity. So I think for me, the key points here, you have to present the information in a mode that the patient needs. So is it video? Is it some sort of interactive mobile device that they can step through different screens and learn about different processes along the way? Are you presenting the information on a timeline that the patient needs? Are you presenting the information over time, not just a static point in this journey, but is the education process continual? Do you allow for opportunities, multiple opportunities throughout the patient journey for them to learn and be this evolution in the education of the patient? And then a few people have talked about this already today, but the concept of presenting information not only to the patient, but the caregiving teams. So is it who and how are you educating maybe the family members of the patient around this process? Because we know that a lot of times the patients rely on family and friends to help them through this process. Are we doing enough, or are we presenting enough information that the patient can confidently go back to their family or care team and say, this is what's going on. Can you help me make a decision, or can we talk about this? And that goes for the primary care physician too. I think somebody made a point earlier, like, are we presenting enough information to the patient that they can be confident in going back to their own primary care team and saying, this is what's going on, or this is where I'm going. So, and Deb Collier said it earlier as well, right information at the right time in the right context is really the key for truly engaging patients in clinical research. So just 3 quick ideas around best practices for health literacy. It's around design, engagement, and activation for the patient. So when you're designing and developing ways to share information with the patient, are you doing it with the patient perspective at the forefront of how you're creating this material? Are you building in engagement points for the patient to continually learn throughout the process? What works best? Engagement has to be multimodal. Is it audio? Is it video? Is it an interactive application on the web? Is it paper? Paper's a mode of education. And I think of many times that I worked as a caregiver for my grandmother, and the piece of paper with a simple diagram was the best way to present information to her. But as long as she had that piece of paper, she felt confident in what she needed to do as a 95-year-old recovering from a hip fracture. That's a simple mode of education. And then activation. What's the environment for information sharing, and can the patient actually act on the information that you're presenting them? So, just presenting numbers, figures, statistics, is that information that the patient knows what to do with? How do they act on that information? And that's it. Those are my 5 minutes. Thank you very much.
Thank you very much, Alicia.